You've been evaluated in the emergency department and diagnosed with an abscess. Now let's take a moment to discuss exactly what an abscess is, how you should continue to care for your abscess at home, and signs you should look out for that may require you to return to the emergency department. Sometimes called a boil, an abscess happens when bacteria gets trapped under your skin and starts to grow. Pus forms as the body responds to the bacteria. Bacteria can get in under your skin after an insect bite, ingrown hair, blocked oil gland, pimple, cyst, cut, or any type of puncture wound. Small abscesses may not need to be drained and can be treated with just oral antibiotics. Most abscesses, however, will need to be drained in the emergency department using a procedure called incision and drainage. For large abscesses, sometimes a gauze packing or drain will need to be placed into the wound to allow for appropriate drainage at home. Antibiotics will only need to be prescribed if there are signs of cellulitis around your abscess. Your physician will have evaluated you for this and notified you if you will require antibiotic treatment. As you prepare to be discharged home, here are some helpful tips that can help you care for your abscess at home. Your abscess wound may continue to drain for 1 to 2 days after it has been incised in the emergency department. Cover the wound with a clean, dry dressing, and if it becomes soaked with blood or pus, change the dressing as needed. Wash your wound and the skin around the wound regularly using warm soapy water. This can often be done most easily in the shower. Washing your wound regularly should be conducted until your wound has completely closed. To ensure adequate hygiene, it is important that you wash your hands both before and after cleaning your wound. Some wounds, such as those that required packing, will need to be evaluated within 2 to 3 days in the emergency department. Your provider will have informed you if this is the case. If you've been prescribed antibiotics, make sure to take these as directed to ensure you have proper wound healing and to prevent the spread of further infection. While at home, it's important to keep an eye on your wound to look for certain warning signs that may indicate worsening or spread of infection and prompt urgent return to the emergency department. These include increasing redness or swelling around the wound, red streaks leading away from your wound, increasing pain or severe pain coming from your wound site, continued pus draining from the wound after the first 2 days. If the pus from the abscess reaccumulates while you are at home, or any fever of 100.4 degrees Fahrenheit or higher. If you experience any of these, please return to the emergency department immediately for further evaluation.